Still in Osun State, the State House Assembly's Committee on Finance and Appropriations today quizzed 9 ministries, departments, and agencies during its ongoing 2026 budget defense exercise. During the exercise, heads of MDAs in the health sector were taxed on the need for quality healthcare delivery and revenue generation drive. Toby Sanusi completes the story.
It is the fourth day of the 2026 Budget Defense Exercise at the Osun State House of Assembly, and the Ministry of Women, Children Affairs and Social Welfare kicked off the exercise, presenting a budget projection of 2.4 billion naira as the Finance and Appropriation Committee, led by Olumide Fatumise, quizzed the ministry on efforts to curb rape cases in the state.
The BAPAT is a brainchild of this institution we are in. If there's no implementation, these laws are just there. Then will our people, the women and the children, will they feel secured in this our society? As we stand in Osun, rape cases are going, they are rising.
On the rape cases in the society, I'm happy to inform this honorable house that during the year we were able to open the SAP center that is renamed as the Soccer Center at the State Hospital at Shubiaru. And since we've reopened that place, we've been able to treat so many cases on rape cases in the society. And the perpetrators don't only go like that. We have some that are already in Elisha.
Next was Uni Osun Teaching Hospital, led by the chairman, Governing Council, Niyi Owolade, and the Chief Medical Director, Babatunde Afolabi, who presented a proposed budget size of 16.8 billion naira with a revenue projection totaling 5.5 billion naira. The Speaker, Olumide Egbedun, then goes ahead to task the hospital on the need to increase its revenue to cater for its personnel cost. But the CMD, Dr. Falabi, says revenue has so far increased to 200 million naira, while he called for provision of equipment like the CT scan and MRI to generate more revenue through services rendered, while he also highlighted some achievements and challenges at the Uni Osun Teaching Hospital.
Aside that, I strongly believe you can do better in terms of the revenue.
We are crawling with our income generation of about between 50 and 60 million. I'm proud to tell you that now we are clocking 200 and something million naira every month. Because we made courtesy visits to them at redemption camp to see Baba Adeboye. We congratulated him on his birthday. I'm glad to tell this honorable house that the Adeboye and the Redeemed Christian Church, they are donating to the hospital a sum of about 350 million naira worth of equipment. This our budget is speaking to what we want this year. And we want this honorable house to assist us. Because a teaching hospital without a CT scan, a teaching hospital without an MRI, a teaching hospital without upper and lower GI endoscopy, we have a number of specialists who are wasting away. In radiology alone, we have 5 consultant radiologists. If you have a CT scan, we have an MRI, I can assure you more income will come into the hospital. Not only coming to the hospital, we will be able to serve our patient better.
The Commissioner, Jola Akintola, thereafter led the Health Ministry to present a 19.8 billion naira budget proposal, while the Osun State Drugs and Medical Supplies Management Agency tabled 1.4 billion naira. However, the Health Ministry's budget was placed under review as the Appropriation Committee queried some discrepancies in the figures presented. After presenting a total budget proposal of 5.1 billion naira, the Osun State Health Insurance Agency was questioned on efforts to enroll people in the informal sector into the insurance scheme, while the Executive Secretary of the agency, Razak Akindele, highlighted the lack of law enforcement as a critical setback in enrollment.
The informal sector, what is this agency doing in making sure that the market people are artisans? These are people that work under different conditions every other day, and they need access to quality healthcare. What are you doing in making sure that you bring all these people in the informal sector under the umbrella of the cover this agency is offering?
As at now, we have about 13,800 people from the informal sector who have registered. There is a policy in Lagos now that as a taxpayer, you have to show, for you to do anything in Lagos, For your child to be admitted in the school, must show evidence of registration with state insurance. For people to renew whatever, there must be. So I want to please plead, we will still pay, an advocacy visit, that if we could do this thing, is going to help us too in Osun State.
Other agencies that presented their proposed budgets at the ongoing defense exercise include Primary Healthcare Development Board with 3.3 billion naira proposed budget, Osun State Agency for the Control of HIV and AIDS, Osun State Traditional Medical Practice Agency, and the Osun State Hospital Management Board. The defense exercise continues tomorrow as the Ministry of Commerce, Industry, Cooperative and Empowerment, Water Resources and Energy, Rural and Community Development, and Public Account will be defending their proposed budget size. Toby Sanusi, Western Spring Television News.